Welcome, everyone. Thank you for joining us today. I'm going to hold on a few seconds while our platform's letting everyone in. In the meantime, you're more than welcome to use the chat box, say hello, let us know where you're tuning in from today. We'll get started in just a minute here. Welcome, welcome. Thank you, everyone, for joining us. We're going to hold on just a second here. I see our numbers growing, and that means our platform's letting you all in. We are so excited for you all to be here for this discussion with us today. Feel free to hop in the chat, give us a greeting, and let us know where you're tuning in from. All right. Well, welcome, everyone. We will go ahead and get started. Thank you for joining us and welcome to today's webinar, Beyond the Numbers, Choosing the Right Mental Health Care. My name is Jackie Zimmerman, and I'm the Public Education Associate at Mental Health America's National Office, and I'll be moderating today's webinar. Just a few notes before I introduce our presenters. This webinar is being recorded and will be emailed out to participants within 1 week. We do not offer CEUs currently, but if you'd like to request a certificate of attendance, we have a form that you can fill out to do so. That form link I'll put in the chat here shortly, but it will also be included in your follow-up email. Today's webinar will be panel style, so at the end, if time allows, we'll take a few questions from the audience. Please feel free to post your questions and comments in the chat throughout the presentation. We always love to hear from you and hear your comments and share your knowledge in there as well. And today's webinar is our second in our two-session Beyond the Numbers series for BIPOC Mental Health Month. So you can access our BIPOC Mental Health Month Toolkit Beyond the Numbers on our website, which I'll also post the link to in the chat here once we get started. And now I'm excited to introduce our presenters for today. We have some really wonderful experts with us, and I'm just going to give you a little bit of background on each of them before we get started. Kylie Jones is an associate clinical social worker who was born and raised in Riverside, California. Jones has worked in the urban Native community within the Los Angeles and Riverside communities for over 6 years. Her areas of focus include intergenerational trauma, race and ethnic relations, identity development, self-worth and self-esteem development, and life transitions. Welcome, Kylie. Omar Sharif is a MD, MBA dual degree graduate of St. George's University School of Medicine. He currently practices at Creedmoor Psychiatric Center and serves as an executive board member of the HEAL Collective, a New York-based nonprofit dedicated to spiritually integrated mental health education. Welcome, Dr. Sharif. Alex Purple-Lira is an educator, activist, and community organizer. She's the founder of the Women of Color Sister Collective, which offers a wide variety of women of color-focused events, circles, and workshops that educate, motivate, and empower women in her community. Welcome, Alex. Dr. Fahad Khan is a licensed clinical psychologist with a degree in clinical psychology and a master's degree in biomedical sciences. He's a faculty member at Concordia University, Chicago, and College of DuPage. He is a fellow at the International Association of Islamic Psychology and serves as an editor for the Journal of Muslim Mental Health. Welcome, Dr. Khan. And we have Dr. Charmaine Jackman, who is a Harvard-trained licensed psychologist. Jackman has over 23 years of experience in the mental health field and is the founder and CEO of InnoPsych, an award-winning organization on a mission to disrupt racial inequities in mental health. She also consults with organizations on topics including mental health, racial trauma, and employee well-being. Welcome, Dr. Jackman, and all of our fantastic panelists today. We are really excited to dive into this discussion. Today, we'll be talking about how to find the right mental health care for you. As we know, everyone's journey with their mental health looks different, and we have lots of factors that play a role in how we care for ourselves and what type of healing might work or not work for us. Today, we're going to hear from these experts about the forms of health and healing they see making a difference that are culturally responsive and may be non-traditional. So we're going to jump right into it. For all of our panelists, we'd love to hear from you. Just tell us a little bit more about your own work within mental health or community care and culturally responsive practices. What are some of the benefits that come with those practices?
I'm happy to get us going. Welcome to everyone. It is so wonderful and an honor to be here having this conversation and to be part of this esteemed panel. So I am the founder of a company called InnoPsych, and our goal is to really make it easier and faster for people to access mental health care and therapy resources. And I think one of the things that I've found really important is kind of translating kind of what we've trained into something that's culturally responsive, that people get, that's relatable. I think the way that I was trained really didn't necessarily, some of the things didn't speak to my community and the communities that I work with. I am a Caribbean woman, I'm a Black woman. And so some of the things that I learned didn't work, right? And so I've had to do the work of unlearning some of my training to really make it relatable to the organization, to the people that I work with. But I've also found it helpful to partner with organizations like Mental Health America and with community organizations like churches and other community-based organizations to really spread the message about mental health and therapy and why it's important. So I think I come from more of an educational perspective and really trying to help people understand why this is helpful for us to know strategies that help us to heal and recover from trauma and many different experiences that we've had. And the last thing I'll say is that it's also about inspiring the next generation of therapists. Psychologists make up less than 15%, psychologists of color make up less than 15% of all psychologists in the US. And so I feel a personal mission to really encourage people to think about mental health as a viable career, as a profitable career, because there is a request for people to have clinicians who understand their cultural background. So I'll leave it there, but really around education, partnering with organizations and thinking about the workforce for the next generation.
I'm happy to go next. As in my bio, right, I'm a wellness provider for the Indigenous Circle of Wellness, also known as ICO. It's a private practice that is Indigenous based out of Los Angeles County. And with that, we partner with other community organizations and sister organizations like the So Oceanala Sister Project, the Metzley Project, right? And these are all cultural-based programs that center around community, because with our framework, we are kind of focused in on, right, these cultural and Indigenous practices where we see the medicine wheel as a guide, right? We have 4 quadrants to our wellness, the emotional, spiritual, mental, and physical, right? But with that also comes the Indigenous core values of relationship, responsibility, reciprocity, redistribution, and respect. These are all community-based, where the individual gets their power from community, but the community gets the power from the individual. So just like a ripple in water, it spreads outwards, right? We focus on us as individuals, goes out to our community. As we also pour into our community, it's pouring into us as individuals. So we're really kind of looking at this holistic, whole person care when we think of mental health, because there are so many different traditional practices and ways that maybe we don't know how to verbalize, or we don't know to recall with our memory, but our bodies hold and our bodies know. And we bring that back and we bring that forth as in ways of touching on all aspects of who we are to bring around this balance and this health for everyone.
Thank you for sharing. I can go next. So my name is Purple. I'm so excited to be here today, especially to talk about something that's very dear and important, to the work that we do for the Women of Color Sister Collective and, our respective communities. The Women of Color Sister Collective grew out of an autonomous community space, Eastside Cafe in the Northeast Los Angeles. And it was out of a need, mental health at that time, back in, 2016, 2014, 2015, like mental health really wasn't talked about, especially in communities of color. I think that during the pandemic, it opened up the opportunity to have dialogue and to talk about not only our own care, self-care, but collective care and talking about our mental health. It gave us time to really like slow down, stop, and reassess where we were all at. It was a very scary time in the world. And I think, it gave us the opportunity to check in with each other, which is, really important. And in the work that we're doing with the Women of Color Sister Collective and Eastside Cafe, we've been providing safe spaces for the community. I think to just what I see my role in is, I'm a big advocate for mental health, for therapy. I myself have gone to therapy with Indigenous Wellness Collective, which is awesome, with Monique. And, I think that I've been this person, and our collective has been this safe space to introduce folks on just really talking about mental health, providing a safe space to talk about things that we as a community are struggling with. We're in marginalized communities, disadvantaged communities, where there's a lot of issues and, systemic issues, and it impacts our mental health. It really does. And I think in the political climate that we were in, also during the pandemic, a lot of us were looking for community. A lot of us organized to offer, care packages to the community, offer, I know that we did food distribution. We took matters into our own hands and started, really organizing and talking to folks who were unhoused and asking what resources they needed. And sometimes I think it's hard to talk about the struggles that we are having, but when you have community, when you have a safe space where you can do that, I think it opens up your path for healing. And that can be in many ways, whether it's holistic approaches, whether it's meditation, whether it's spiritual connection, whether it's church, whether it's prayer. I think the most important thing is finding something that is safe, where you can begin. And then from there, really leaning on your community and asking for other resources. And, they're all stepping stones into discussing and, realizing, man, we all have things that we're, peeling layers from trauma, childhood trauma that maybe we don't even realize we are, carrying in our bodies, and in our spirit. And when we have that safe space, I think it really gives us the opportunity to just explore new avenues, like therapy, meditation, yoga, whatever it is that's going to work for us. I think everybody's journey looks different. Which is why I'm so thankful that we have the opportunity to talk to all these experts, because I think they're all valid and they're all very important.
Hi, everyone. Thank you so much for this webinar, Mental Health America, and Jackie for organizing everything. And it's an honor to be here. I'm the director of Khalil Center. Khalil Center is a community mental wellness center, psychological and spiritual. And it was originally created in the Chicagoland area to cater to a very marginalized population, Muslim Americans who, for many reasons, and we know the stigma that exists for mental health generally, but also if you look at some of the underserved communities, culturally or religiously underserved, the stigma is even greater. So it was created to cater to that, to educate the community about mental health and wellness, and along with that, to also represent our a rich tradition. If you look at the first psychiatric hospital ever built, it was built in Iraq. And so, there's a huge legacy that exists from a spiritual as well as psychological, psychiatric context that needed to be kind of reintroduced. So part of the work that Khalil Center has done is in Muslim mental health. We're the largest provider of Muslim mental health in North America. Along with that, we've done a lot of work in spiritual health as well, making the connection between spiritual wellness, personal wellness, and how that can translate into psychiatric or the prevention of psychiatric illnesses and psychological wellness from that perspective. And so that also allowed us to work closely with the clergy, with the scholars, and introducing publications that help individuals understand why it is important for us as human beings, from a cultural perspective. I'm a Pakistani, from a Pakistani cultural perspective, or even from a religious perspective, why it's important for me to keep my wellness, my spiritual wellness in mind as a prevention towards psychiatric illnesses. And if there are psychiatric illnesses, why is it okay for me to seek treatment, whether it's through therapy or medication? So that's been part of our work in reducing a lot of these barriers and increasing access to healthcare. And the center is open to everyone. Obviously, our mission and vision is rooted in the religious tradition, which is to help people, those who are suffering. But people who have come here, we have data to show that they previously would not have gone elsewhere, and now that they've come here, they actually feel more comfortable. There's less stigma. There's less fear of therapy or confidentiality and privacy. So that's the work we've been doing here as well as internationally. Thank you.
I guess I'm last for this. It's hard to follow up everybody, but I just want to say it's a pleasure to be here, and I wanted to thank MHA for giving us the opportunity to all be here on the panel and speak to everybody today. So like Jackie mentioned, my name is Dr. Sharif. I am a psychiatrist, and I work at Creedmoor Psychiatric Center. It's a state psychiatric facility in New York. And for me, I work with patients that have severe mental illness. Their mental illness is to such a severity that they cannot actually function properly in like regular society. So they require a great deal of social support and benefits. We have mental health housing, mental health day programs, a ton of mental health facilities and programs here for them. We have social workers, case managers, psychotherapists, counselors, and then myself, psychiatrists, who work with these patients. And what I can tell you is that there's a very heavy stigma attached to our field, and I know that everyone else in the panel can agree with me, that the hardest step is just getting your foot in the door for your very first appointment is often the most difficult and challenging thing. And then once you do that, the rest actually feels a little easier, because once you actually connect with us and the human connection, the bond is made, everything else really is just more of the process and flow. The hardest thing is making that initial connection. And it's a very scary thing having to see a psychiatrist. We're not really associated with like happy things. Mostly we're associated with medications, injections, psychotherapeutics, psych meds. And there's an even heavier stigma attached to receiving psychopharmacological treatment. And what I can tell you is that it is an honor and a privilege to be a psychiatrist of color coming from the South Asian perspective. Like Dr. Khan mentioned, I work a lot with Muslim mental health as well. And I also work a lot with South Asian mental health. But on top of that, the second thing that's super important is men's mental health and ensuring that there is a male presence as well. And I think this is something that is very desperately needed, is having male voices and allowing men to feel comfortable coming into the mental health system and receiving mental health care without it having to be in response to crisis, which is typically how we tend to see men entering into the mental health care field. But one of the things that really keeps me going is being more than just a prescriber. And I know that everyone here on the panel can speak to this. We are so much more than what our degree and what our work actually is. And the work we do is not limited to just offering therapy and counseling. That is literally a piece of what we do. The majority, the great overwhelming majority of what we do is we help our patients navigate a very complicated and difficult system while at the same time caring for your holistic needs. We're not here to push pills on anybody. We're not here to push specific modalities or specific techniques on somebody. We're here to try and make your life better. In a nutshell, at the end of the day, when you walk out of our door at the end of a session, we're just trying to make your life a little bit better than when you first walked in. And that's what I want everyone here listening to take from each of us when we speak today, that you'll hear a lot of technical terms, you'll probably hear a lot of psychotherapeutic terms, you'll hear a lot of epidemiology, you'll hear a lot of different things from each of us, because each of us are bringing a particular expertise that we're coming from. But ultimately, at the end of the day, if you are not receiving treatment, or if you know someone in your friends or your family or coworkers or somewhere in your circle who is looking for treatment but resistant, wanting to connect but doesn't know how, is overwhelmed by a system that they don't understand or they don't think they can afford, that's what we are here for, to help connect you and help navigate you through that. So my sincerest thanks to Mental Health America for this, and I'm looking forward to the next questions on the panel. So thank you, everybody. Thank you all for this. Much appreciated.
And
you,
can I, Jackie, can I just elevate some of the things that Dr. Sharif said, because I think they're so important. And I'm glad that we are representing kind of a range, a continuum of care from community to maybe outpatient to inpatient. And I think one of the things that I have also found is for people of color, we often wait way too long. And part of it is we don't really sometimes understand what's happening to us. We don't know how to ask for help. We've been taught to push through it, right? So often there are a lot of cultural messages that also prevent us from getting care. And so what we often see, as Dr. Sharif mentioned, we often see people ended up in crisis. And then we have that cultural message is like, you're gonna lock me up, right? That's the message. And so when you wait so long, then that kind of that is the inevitable thing that can happen. And so, really understanding kind of what your symptoms are and talking to your pediatrician or your primary care physician, really think about how do I understand what's going on with me, and kind of have that reflection can really help you enter care sooner and not need that, severe thing. It doesn't mean some people do need that severe piece, but I really want to just expand on there is a continuum of care and hospitalization is not the only thing.
Absolutely. Thank you all for those great intros, and so much of, what we got bite-sized pieces of, we're going to now dive really deeper into. So I appreciate all of you because it's the perfect segue. What we're going to kind of dive into next, we know that research shows that therapy and medication can be really excellent choices for mental health care. But what you all also touched on is there's so much more than that. And the importance of community of care and other culturally responsive practices that are really vital for BIPOC communities' mental health. So how can community of care and other maybe non-traditional forms of healing complement a treatment plan that includes therapy or medication, or support those who might be hesitant to try treatments within the Western medical model of care?
I'll go ahead and start off, as I know from shared experience from my clients as well as my own experience, my family experience, right? We don't have the best history with the medical model of care. We don't have the best history with medicine, with diagnosing, with understanding treatments, anything like that, right? And so when we really look at it, the DSM was created by white males, really kind of with that focus of white males being the subjects as well, right? So as we branch out even into female subjects, into people of color, right? Some symptoms may not match, some symptoms may not be present, or they may show differently. So having a struggle of also too, like having to fight for our care has been a common shared experience, right? And so when we kind of take this approach where that isn't the forefront, that isn't the main focus, right? We have better approaches. And this idea of if we include traditional aspects or include cultural aspects, such as others have been saying, right? Things where we include meditation or spiritual practices, right? Body movement practices, different things where we're incorporating all aspects of our body, of ourselves, we tend to have better outcomes, right? And so that's why for myself and for the practitioners really at ICO, we have that foundation. If you have other practices that you incorporate, right? Whether that's prayers to your ancestors, maybe smudging, maybe meditation, yoga, or dancing, powwow music, drumming, different things like this, we all understand that those aspects serve different purposes for our whole being. And that can be what brings us balance and healing in addition to, or just separate of, right? These different medical models that we have. And with that approach is kind of seeing the person before trying to diagnose them or medicate them. And by doing that, we're already opening up a whole different aspect and door to their wellness, right? I've had so many clients who are like in tears, just, I feel seen. I feel like a person, not just another number. I feel like you understand me, or I can relate with you instead of just being talked at, right? And that's such great validation as a provider, but to get to that point as a client or as a participant, right? It can be years, it can be timely, it can be painstaking. And so with that, it's like just that encouragement to keep going, to keep trying. You know what your body needs, your body knows what it needs, right? And kind of focusing back to that point, giving yourself what you need first, and then seeking that extra support can also be that point of just that segue into how do I get help that I need.
Yeah, I would like to add to that. Thank you for acknowledging that sometimes, as we navigate, the medical system, it is hard because, as people of color, sometimes we may not have the words to articulate what we need, or we may not know how to navigate the system. From my own lived experiences with my family struggling with mental health, my mom, was diagnosed with bipolar, and navigating, that with my mom and getting her services, and also finding what was going to work for her and advocating for her in such a young age, is what really helped me find my own spiritual healing and finding my community, and helping others, in finding decolonial ways of healing, reconnecting with, my spiritual practices, my own Indigenous spiritual practices from my lineage, and finding a connection with that is what helped me advocate for my mom and helped me be able to have the confidence to ask for support and seek, services, and, applying for, a social worker so that we can get her that support that she needs. And this happens a lot in our communities, where we see our families struggling with a mental health illness, and we don't know what support, and even what support to get for ourselves. And I think, as I've seen and experienced, I provide women healing circles, which is a decolonial way of having dialogue. We burn medicine, and we create a safe space. And I think that's the key word, safe. When the individual feels safe, then we can begin those steps of healing. And I've seen, women bring their mothers, their grandmothers, children, and witness intergenerational healing, and witness them having dialogue on, issues that maybe they didn't feel safe enough to speak at home. And being able to provide those resources, being able to provide that safe space where they can begin peeling those layers and begin to now seek for the services and feel safe. And then finding ways to support one another, right? When we talk about community care and talk about what are the resources within our community. A lot of us are word of mouth. Like I recommend ICO to everyone, that it really helped me, because for me, finding therapy, I knew I needed therapy and navigating my own mental health. If I'm going to hold space, I need to ensure that my mental health is also, I can't pour from an empty cup. So for me, finding a therapy that was going to be culturally sensitive to my beliefs as an Indigenous woman, as, with my Indigenous practices. And when I'm speaking, I went to lodge, or I, had this, like, they're not going to look at me weird, but understand where I'm coming from and how it's helping my spiritual and my healing. And I think that's important when we talk about mental health, is like, when you go and you find resources where you're going to feel safe to talk about your spirituality, talk about your beliefs, talk about your culture, talk about, your lived experiences. And, as we continue speaking, I think, the key word is, is an individual feeling safe enough to share, safe enough to receive the care that they need. And I think that's when we can begin to continue healing and continue navigating, mental health, because it is a sensitive topic, because it's so important. It's very, very important in our communities that, we all come from, our lived experiences as people of color, and, we've experienced, different, different experiences that have been traumatic, especially in the medical field. So I think that, in hearing all of you and the resources that you provide, and brings me so much happiness and so much joy that, it's a domino effect. I've seen people, when they receive that care, then they can advocate and let their neighbors know, or their community know, hey, I have a therapist that I felt safe with. Maybe, you should try therapy, or, these are the services that I was provided with, and it helped me in my healing process. And I think, it's a domino effect, and it really can help, our communities overall.
I can jump in, because I'm really, I think my focus at InnoPsych is really thinking about how do we kind of challenge and change the cultural messages that we have about mental health that continue to serve as barriers to accessing the range of care. And I think one of the perceptions that we have, it comes from a historical trauma, right? That therapists and psychiatrists are going to do something to like change you and control you and do something against your will. And I really want to emphasize that and I'll speak for the folks of color, right? Our goal is really to engage in a collaborative process with you, where we're not doing something to you, but we're here to understand what is going on, what are the things you're dealing with, and try to work and problem solve, like what will be the best thing, that we can start to support you. So I really want to shift that message, that cultural message that we're going to do something to change you, to change your mind, to change your brain. Like, we're not, well, we want you to change in the ways that you want to change, but we're not going to do anything without your consent or against your will. But I know that comes from a historical trauma where our bodies were used in the name of science and experiments against our will. So we have to acknowledge that historical trauma and how it contributes to the messages and the ideas about and the barriers to therapy today. The other piece I want to add, and I think some Purple and Kylie have talked about that as well, kind of taking a decolonized stance towards the field. And really, again, talk therapy, is kind of the standard, right? In your question, Jackie, you talk about therapy, right? When we say therapy, we're often meaning talk therapy, right? And that's not the way that many of us engage, like sitting in a room with someone we barely know and just telling our story, right? We know that trauma lives in our bodies. And so having access to body-based work and body-based strategies are so important and a really helpful and positive way to heal. So a lot of my work is about teaching people about the range of services that are out there and what might work best for you. And when you come and see me, I'm going to share my, the work that I do, but invite you to know that there are other practitioners and there are other methods that are out there that might be best suited to you. So again, I approach it in a really, like, I'm engaging with you. It's a conversation. Again, I'm not doing anything to you. And so really educating people around what is out there. You talk about traditional healing circles and indigenous practices, which I think are great. There are expressive arts therapy. There's just so many things that are out there, and that people really need to know that there's a range. And so I really want us to move away from thinking about therapy as the one thing, that talk therapy method.
Are we wrapping up? The only note that I would add in for this is, I know that there are also questions in the chat too about that, with regards to, like, say, taking medications and what kind of alternatives we could explore to doing that. This is something that I would encourage everybody to have a conversation with their doctor about. Usually the hard thing is when folks take treatment into their own hands and just decide, I'm gonna do this. I would strongly recommend to always have a mental health professional supervise or guide you along on that treatment. And I usually recommend this to my patients as well, that there are a lot of cultural approaches to this. There are a lot of treatments and approaches that come from back home that have a more Eastern approach than standard Western medicine. And there are different perspectives that our cultures bring. It doesn't necessarily mean that the cultures are wrong or that the Western approach is wrong. All it really means is just, this is a dialogue. This is a conversation to see where the common ground is and where our mutual comfort levels are between provider and for you as the client. So no matter what kind of treatment works best, do keep in mind that mental health is something that is very broad and very different for each individual. What works for a friend or family member may not necessarily work for you. What may work for someone else within your culture or your ethnicity may not necessarily work for you, and vice versa. It's always an individualistic approach to this. So do keep that in mind, that this is a case-by-case basis, always a case-by-case basis. There's never a one-shot, solution to any of these problems. For some people, maybe it's neurochemical. For others, maybe it's environmental. For some, maybe it's something physical. For others, maybe it's something psychological. It could be very different for each person. Therefore, the treatments are very different for each person. But ultimately, the most important thing is to always have a conversation with your doctor or your mental health provider before beginning anything. Whether it's pills, whether it's an injection, whether it's therapy, a specific type of therapy or a specific approach to therapy, or a particular contract or game plan that you have towards approaching your mental health, whatever it may be, always make sure to have a conversation and dialogue with a mental health professional about that. Don't ever solo it, because it's very scary and difficult. Navigating this on your own, it can be very confusing, very difficult, very scary. So it's important to have someone, there with you to help guide you along, so you don't feel alone and overwhelmed in this treatment process. So that's just my 2 cents. And thank everybody else also for their awesome answers that they've given.
Thank you. Any other thoughts on that? Thanks for adding that in, Dr. Schley. Well, thank you all for that great discussion. And I know that we had mentioned this before too, of the importance of just taking that first step and how challenging that can be, and then where to go. And I've seen a few comments come up like this in the chat as well. It can be especially difficult to take that first step when there's a lack of understanding of resources available and ways that care can be combined to fit each person's unique needs. It's not just talk therapy or medications. And for a lot of people, when they think about seeking care, that's what first comes to their mind. And that can be off-putting or intimidating. And like Dr. Jackman said, sitting and talking to a stranger doesn't sound helpful for a lot of people. That can be so intimidating. And that might deter someone from reaching out and trying to find care. So how do each of you suggest people go about taking those first steps to find the care that's right for them and kind of where to go and how to start the process.
So I'm going to say that, taking the first step is often the hardest thing to do, especially if you're coming from a place where you don't have a lot of awareness or experience. I think as a community, first of all, I mean, just, going back another step, as a community, we have to create an environment, we have to create a culture where, going to a therapist or even talking about your problems shouldn't be considered abnormal or unhealthy. I think we, unfortunately, probably because of modernization and the way things are with social media and everything, we have lost the ability to really listen to other individuals just in other human relationships. We're not talking about even within mental health context or a therapist listening to the client, but rather just two people sitting down and having a conversation when one of them is actually listening to the other individual. Like Carl Rogers would say, someone that, if you gave them your full attention and their empathy and listen to them, and you cannot respond to them until, or you can't say anything on your own until you can respond to them in a way that they find acceptable. So we've lost that ability. We really don't have that muscle anymore. We don't want to hear people talk about their problems. And if someone is saying something, we usually are thinking about how to respond back. What do we say back to them immediately? How do we come in and fix the problem? And, me as a psychologist, I can tell you most of the issues that we resolve in therapy, it just comes from the fact that we're just listening to people. And when people talk about their problems, when they're able to truly express themselves, most individuals do have the capacity to help themselves. Really, they just need that supportive shoulder, someone to listen to, someone to lean on for the initial steps. As for those who are still trying to understand how to take the first step, I would say start with whatever you can do. So for some of us, like for me personally, for my own mental health and safety or prevention, just taking a walk outside for 5 minutes every day is the first step for me, because that really helps me clear my mind. It gets me out. It gets get me some physical activity. Mentally, it's good for me. Finding that one true friend, someone who is actually going to sit and listen to you, who's actually going to has enough care for you, or the family member. It could be your spouse, it could be your sibling, if you have that kind of relationship. And if it's therapy, I always recommend just try it for 2 or 3 sessions. I mean, 2 to 3 sessions or 4 sessions, like 4 hours of your life. I mean, we spend more than that on trying a new TV show. If somebody says, hey, why don't you try watching this new TV show? We'll watch at least like 8 to 10 episodes before we say, yeah, that wasn't worth my time. So try therapy for at least 4 hours. And in most cases, if you're with a good therapist, and obviously it's a very complicated process. I don't want to say good or bad therapist, but in most cases, people do end up liking it. So whenever I recommend this to people, they end up saying, oh, that was really good experience, and I kept going. It can't hurt. It's something that we can do, very easily, and especially post-COVID, we can do it online. There are online support groups and forums where you can also seek some help. Counseling, university counseling centers have counselors, schools have counselors. I think in the US, oftentimes there isn't as much of a shortage of counselors than if you look at some of the other countries out there. So try it and see what happens.
I love those points. And I totally agree with that, right? Just go. And it's such a beautiful process to have somebody just listening to you. They don't have any agenda but yours. It is a beautiful process. I think what I would add, I will say I have a resource. I'll just pop in the chat right now. I created a resource for people who are new to therapy. So we have answered like a lot of questions that people have, like what happens in the first session? How do you go about finding the therapist? So we've really broken down those steps for people. But I think that some of the points I would add is like, talking to your primary care physician, talking to your doctor, like that is a great first step. If you're wondering that something's wrong, if I should seek someone, talk to someone, seek some other traditional practice, that could be your first step in getting some support. Sometimes physical illness manifests or have some mental health components. So it's also a good way to rule out any underlying medical conditions that might be presented as mental health. So that's why that's a great way to start there. I think it's also helpful. I think someone mentioned in the chat, having a group of friends or family members who you can talk to. I know for some people of color, it is hard to talk to family because there are the negative messages and the barriers. So, find that person who you will get it and be able to talk with you honestly. There are a lot of, again, there are a lot of programs like peer support programs out there that offer people, therapy like or group experiences. I think like Purple shared her group. There are a lot of different groups like that for Black women, for Black men. So finding some of those resources, we do have some of those on our website. And we do have a therapist of color directory, which I shared in the chat as well. So that's it's a national resource. So you can go there as a start. So we have a lot of resources that really help people kind of navigate that process. Again, our goal at InnoPsych is to make that process easier and faster. I also will say the Mental Health America website, I always use that as well. So check that out for resources. And I think the last thing we'll say, sometimes you wait till we feel there is a problem, but you can go to therapy when things are going well too.
Absolutely. Any other thoughts on those first steps? Thank you all for that great insight. All right, then how about the next step? Once you're in care, whatever that might look like for that individual, say it doesn't quite feel comfortable or it doesn't feel right. And like Dr. Khan said, sometimes you have to give it time. You have to try things out or try different therapists or forms of care. But if someone's been in care now for a while and they're feeling uncomfortable, how can they find resources for other avenues of care or navigate then where do I go from here? I feel like I've reached out and tried and I've done that difficult thing and it's still not helping in the way I need it to.
I'm going to jump in real quick because I love this question because it's like, how do you break up with your therapist, right? There's been a lot of conversation about that. And, one of the things that I really say is the onus on the therapist, because whenever I'm meeting with a new client, I have this little speech that I give them. And part of it is like saying, therapy is a little bit like dating. Like we may not be the right match. We may not click. We may not vibe. And I say to people, I have a network of therapists. So if you're feeling like things aren't working, one, let me know and I'll try to adjust. And if you feel like it's still not working, I can refer you to other people. But sometimes for people that's hard, right? That's, particularly if you come from cultures where you don't challenge authority or you don't challenge elders, that can be a really hard thing to say. As therapists, we know if things aren't really working. And so we need to be honest with you that things aren't working. And I've had to break up with clients and it is really uncomfortable and it's hard. But I also make sure that I give them resources. I think this person will better serve you. And so, but that's a conversation as well. So I think that's a really good point. But it happens where it doesn't quite vibe. And one of the things I really help people to think about, that to just notice that is that relationship. It doesn't mean therapy or whatever resource you're using isn't working. It just means that relationship isn't quite working. It's like dating. So then you have to leave that relationship and find one that's a better fit.
Definitely. I like to add to that too, is like, if we think about relationships too, right, that they serve purposes. And so it can be that we've entered into a therapeutic relationship, it served its purpose, and now it's time for us to move on to a new one or onto a new interaction, a new type of care as well. And so I did see that in the chat too as well. Somebody had been with their therapist for 20 years and not feeling like it's a right fit anymore. You to remind you, right, this is your care. You have that choice and that right to say, okay, things need to change, or this is the end for me as well, right? And that's scary, that's like fear provoking, right? But at the same time, realizing it wasn't all wasted, that there has been progress made. It's just time to move on to the next part. So we don't stay in first grade forever, right? We go all the way through to 12th grade, maybe even college further, right? And so thinking things naturally progress in life as well. Therapy can be that same aspect. And so if we're advocating and we're not receiving that response back, we also have that choice to say, okay, well, then this isn't a good fit for me anymore, and I'm going to have to leave, right? And always ask for additional resources. Just like Dr. Jackman was saying, like most therapists have networks where they can say, okay, I'm not the best fit. Here's some other resources, or here's somebody else that I know works within this area, right? So just like there's CBT, there's EMDR, there's DBT, there's all these different acronyms, right, of different types of therapy. We can try different things. And if we're willing to do that and our therapist doesn't have that training or that experience, we can move on to someone else. We can move on to different approaches as well, right? Just as like the others have said here as well, body holding on to that trauma, it's not just going to be released through talking. We have to have different ways to release it through the body as well. So looking at what that may be or what I am comfortable with, right? If that just means I need to move my body, I need to do different things that are healing for me, right? Maybe for my inner child, or even for just that aspect of body movement, I can look at implementing that into my own routine, where I go swimming or I go do a gym class or something like that, where now this is added into my wellness. It's all continued, it's all encompassing, and it's not just focused on that part of the talk therapy or the CBT or the work with the therapist, but now it's my lifestyle, it's my whole life that's all coming together.
Thank you all for sharing. I think that I can tell from the comments, everyone's just learning so much and growing. So I appreciate you. And if you're commenting and asking questions and we haven't gotten to them yet, we're hoping for some time at the end where we can, and even some of yours that you're asking, I see on our list that we're going to be talking about upcoming here too. So thank you all. The next thing I kind of want to dive into is we know that there's many barriers to seeking care, and something that we talked about actually in the first webinar that we had earlier this month in this series was kind of that stigma and shame or fear that can come from finding mental health care or asking for help or saying that I need help. And so for people that are experiencing maybe that stigma or shame or fear, what would you say to them where they recognize that a loved one might need that extra support or help, but you see they're feeling hesitant due to all of those outside factors? You know, how do we really combat that and ensure people are getting the care they need, regardless of those feelings, and kind of breaking through those barriers that are very difficult?
I want to mention a few concepts here. One is probably one of the most common questions that come up whenever we're presenting in the community is that I know someone I love, a family member needs help. How do I get them to go seek help? And the black or white answer is really you can't do anything, because the person has to have motivation. But the real question to ask is, how do I create that motivation for them? And the answer that I like to usually give, and again, this is something coming from our spiritual tradition as well, is that, you know, you have to model the behavior. Like if you oftentimes, whenever somebody seems to have a mental health problem or, you know, whatever disorder, they are labeled and they're just kind of like isolated, and like this person needs help and we're okay, we're all healthy, but this person is the one that needs to go see somebody. The fact is that everybody can benefit from therapy. You know, I myself, I go to see a psychologist. I don't, you know, have any severe issues. I'm a fully functioning individual. in a very healthy relationships. But I think I benefit from that interaction, even if it's twice a month. So I often suggest that you should go see a therapist yourself, and you'll see the benefits of that. And the other person might see that and be motivated, although there's no guarantee. So oftentimes we are surrounded by individuals who, if you look at the model of change, right, they're in a very pre-contemplative state where they're not ready yet. They don't even think that they have a problem, or sometimes there may be some hesitation. Maybe they just need that little bit of push. So having that conversation, like I mentioned earlier, listening to them. But the other thing I want to say is that, for people who themselves have thought about it and they understand the importance of therapy, but they're just kind of afraid because they don't know what it looks like. They're not sure what it's going to feel like. And we talk a lot about safe spaces, which is good, but I also want to talk about how do we create resilience, right? How do we take action? Sometimes you have to put yourself in a little bit of discomfort, which is going to increase your resilience, which is going to help you move forward. I mean, people who come to therapy and most of us who treat a lot of these issues, even anxiety-based issues, how do we treat anxiety? Well, we have to face that which is causing us anxiety, right? So, and granted, that's within this safe space that we have created, but I want to, if this can help hopefully motivate somebody, that if I want to learn how to do skydiving, then I'm going to have to go jump off of a airplane, or at least do something virtually, something that creates that same level of anxiety or similar anxiety, then that might help me. So I would say, take that first step. It's going to be difficult. It's going to be hard. Everyone who took that first step towards anything always felt the same way. And so nobody goes into therapy knowing exactly how therapy is, or even taking medications, for example. Dr. Sharif is here. I'm sure a lot of people are hesitant. What are the side effects? What will happen? And most medications, the side effects are reversible. Like if you stop taking the medications, the side effects go away. It's very rare for a medication to cause permanent damage to an individual. So I always tell people, it can't hurt. Yes, there'll be side effects. There'll be discomfort, but it might help you to get through, especially the therapy that we're working on. And it might be a beneficial, aid that you need in this process.
I would just add, I love everything you said, Dr. Khan, and I wholeheartedly agree. I think it would just underscore, you have to come from it from a position of care and compassion and not judgment. And so I really care about you. I noticed that you don't seem to be smiling as much. I noticed that you seem, so I talk about behaviors, like what you notice. I've noticed that you're sleeping more. I've noticed you're not able to get to school, whatever those behaviors are. And I'd love to talk to you about ways that you can, about ways that I can support you around that. I'm willing to go with you. I'm willing to make calls. Here are some numbers, right? So, and I agree with trying to process yourself, because then you have the firsthand experience.
Absolutely. Thank you both. Any other thoughts?
No, I mean, honestly, when it comes to destigmatization, stigma is born out of fear, and fear is born out of ignorance, ultimately. So where stigma comes from is really just not knowing what this is or what this is about. And one of the ways to destigmatize is, one, to educate yourself, and then two, to actually interface with the folks that provide this. So MHA is doing this right now with you being able to put faces to all of us and what we do. And for our friends and family members, or those we know in our circles who are apprehensive, this is one of the best ways to help get their foot in the door, is to put a face on a provider and allow them to see and hear who we are and what we say and how we are. And they realize how human this field actually is. It's not cold and clinical. At its very core, our field is about treating the human condition. And it takes someone with a warm and open heart in order to help someone with a broken heart. And that's something that I feel a lot of folks need more time to understand. So rather than telling someone, you need to see a doctor or see a therapist, which sounds really condescending in conversation to say that, even if it's true, the more important thing would probably be, hey, there's like a really nice YouTube video with like this therapist online who's talking. Why don't you take a listen? Or why don't we like listen together? Or I know someone who goes to therapy Maybe they can tell you what the process is like for them and what they like and what they don't like. I usually consider therapy to be a lot like eating at a restaurant. Just because you eat at a restaurant, you don't like the dish, does not mean that you swear off food for the rest of your life and starve. That makes absolutely no sense to me. It just means that one restaurant, that one vibe, that one dish, that one chef, maybe didn't work out for you. And that doesn't mean that you starve. It simply means try something different. Maybe a different recipe, maybe a different restaurant, maybe a different chef, maybe a different environment, maybe a different type of service. Everyone has a different plate that suits their palate. And that's the most important thing to emphasize. However, getting someone's foot in the door of a restaurant really comes down to good marketing, good connection, and making sure that you speak to their hunger, speak to what you feel their apprehension, their fear is, and what you feel they need best, you know? So that's what I recommend. That it really comes down to having a really open conversation and not using stigmatizing language. So don't go around diagnosing friends and family and saying, hey, you got bipolar, you need help. Don't do that. That's not your job. And truthfully speaking, that's not our job either to throw diagnoses in people's faces. It's our job simply to sit down, just have a heart to heart and have a human connection. And then from there, we guide you along on that process. So stigmatization really comes down to each of us individually and how we have those conversations with everybody. So that's probably my 2 cents. And I would say for speaking just in particular on men's mental health, it's even more important for men's mental health to ensure that you do not use stigmatizing language and you do not use punitive language, that I will call the cops on you, or I'm going to throw you into the ER, or I'm going to get you locked up. Men's mental health is something that is very complex, and it is treated under the veneer that it's all just toxic masculinity. When the truth is that broken men break other things and other people. And the most important aspect is treating men not as criminals or not as like aggressive, power hungry, macho men, but treating them as, this is someone that was a child, a boy, that grew up to be a broken man. And what he needs is healing, what he needs is help, what he needs is support. So speaking to that and allowing the boys and the men in your life to be more emotionally honest, 1, 2, being more vulnerable, and then 3, being better emotionally connected to the people around them. That alone is a big step. Before you even get them to a clinic, that's a huge step right then and there. So it comes down to what kind of messaging we treat our boys with when it comes to, tough boys don't cry, strong men don't cry, eliminating that kind of language and making sure that we don't gender emotions. There is no feminine or masculine emotion. There's only human emotion. And so men can be weak, men can be vulnerable, men can cry, men can be hurt, men can be heartbroken, men can be depressed, they can be anxious, they can be insecure, they can be all of it and everything. So this is probably a major thing that I would push for, is it doesn't start with us, the clinicians. It actually starts in the home, actually starts with families. And then we're the ones who help guide it along as it comes. So that's just my 2 cents for that. Thank you, everybody.
Absolutely. Thank you so much for bringing up those points as well, and shining a light on men's mental health, which is so important for us to talk about in these spaces. For each of you, you come from your own background of providing care, whether that be traditional or what we call non-traditional, and a lot of our audience watching are also providers of some sort. And so what can providers do to better serve our BIPOC communities? And how can providers start to incorporate community of care into their practices?
So I can tell you what we have done at the Kylie Center, which has been very successful. One is we go to the community. So I think oftentimes providers expect the community to come to us, and when they're in need of services. But we go to the community. We teach them about mental health, mental wellness, and also not a westernized model of very reductionistic model of what a psychiatric illness might be, but rather a broad spectrum. Like I mentioned earlier, there are people who may have some spiritual illnesses they need to work on, may have a lot of anger and jealousy and issues related to their lives, and then there are others who have psychiatric illnesses that go from anywhere from having healthy anxiety to unhealthy anxiety to now debilitating anxiety where they can't get out of the house, or OCD, for example. So we teach the community members. We also knew that members of the Muslim community oftentimes went to their the clergy whenever they needed help. So we created that working relationship with the clergy, where we helped them take the burden from them and teach them and train them as to what mental health looks like, and where does their where is their boundary ending and where's ours beginning. So we don't overstep ours and they don't overstep theirs. We also, the way our office is set up, people who come in, they take off their shoes. We have a very spiritual environment, and that's very welcoming for people. So people see that as a spiritual wellness center rather than a psychiatric clinic. And those two words can make a huge difference. And coming down to words, using positive language, right? That also helps talking to the community. So those are some ways that we've been able to do it very successfully. We have data pre and post showing that like I said, their fear of therapy, confidentiality, their comfort towards coming to see a therapist, talking about mental illness, all of that was improved through the work that we did, at least in our communities.
Yeah, to add to that too, right? Having those inviting spaces that feel like home, or feel like your spiritual place, feel like you are welcomed, really, right? Makes a big difference. So even like at ICO, our office looks like a living room, not an office. We don't have a secretary's desk. We don't have really much of what we would consider like a therapist, Western therapist office. We have couches, blankets, pillows, right? We have all these different things that are put in place. We even, for essential oils, right? We have our sacred medicines out and available. Ways to make you feel welcome as a person, right? We also partnered with the Department of Public Health within LA County to do different studies and to do needs assessments. We were able to then create a toolkit, right? How to kind of work within Indigenous communities, and that's accessible online as well. I can just drop the link in the chat so you could view that, right? But it's agreed to that point of going to community, not just like, hey, I'm here, come to me, right? So why should we come to you? This point of you show up for us, you're there for us, we're in community, we're sharing spaces, we're relating, we're connecting, right? Just as Purple was saying, that point of word of mouth. If there are different events or gatherings or different things going on in community, showing up to those, right? Showing your face, being there, being present in those moments now makes me want to show up and be present in space with you for my own mental health, for my own wellness, my own healing, right? We see these as we have marches, we have gatherings, powwows, different things like that. Vendors set up booths, we give out information. We see this even like the electric company was at a powwow, right? Talking about the services they give out. Why don't we have that for our therapists or for our wellness providers? We can do the same things, right? It is being there, being present, showing up, and just kind of getting the information out also helps to decrease some of that stigma, to decrease some of that unknowingness and that fear around it, right? If I see you I'm with my family and we're laughing, we're joking, we're having a good time, we're able to connect, well, then that makes it seem that much easier to do that in a space where I'm talking about these hard things or I'm asking for help even.
I love all those things. And, I will add to what Kylie said. When I don't have an office now, but I do teletherapy now, but I would offer tea or coffee, I would have snacks, right? So, providing for people's needs. Sometimes they're coming from work or from something. And so there's just trying to anticipate what people's needs are. I think also if you're a provider who is not BIPOC and you haven't really worked with BIPOC communities, it is really important that you do the work and the training to learn the skills to do that well. I have heard from clients or from people who've engaged in therapy where they've experienced racism in the therapy room, they've experienced microaggressions, and that was very harmful, and it really left a bad taste in their mouth. So really, if you're not the same way that we're trained to, like, we don't practice outside of our expertise, if we're not practicing, if we're not skilled in working cross-culturally, I know some of our fields haven't done a good job in training us to do that work well. So do the work first. Work with a clinician of color, shadow, engage and immerse, but be honest with yourself about what your capacities are, so you don't, cause further harm.
Thank you. I would like to add, I think everything that you all mentioned, and then, collaboration. I think it's important to collaborate with the communities, with, organizations that are doing similar work. When we become a united front and support, then, we elevate our collective power. So definitely collaborating, going out to the community, I think it's very, very important. Meeting the community where they're at, providing those resources, instead of waiting for the community to come to us. I think collaboration, that's the beauty of collaboration, because you get to go out into those communities and serve the, LA for us, it's pretty big. And so, a lot of the work that we do for the Women of Color Sister Collective is in the Northeast Los Angeles, but I float around everywhere in the LA area, and even do virtual workshops. I've been able to reach folks in Chicago, New York, even Canada, with the meditations and workshops that I do. So I think when we meet community where they're at and provide, that welcoming space, it really is just that stepping stone. I think it elevates that curiosity of like, what is happening here? And, just like the folks that are here today, they were curious to, about the topic. And I, my hope is that, you're able to explore beyond the conversations that we're having today. And we hope that, we created that safe space and that welcoming space to have that dialogue. And that, you leave more curious so that you can attend more events, or even sign up for therapy. I'm a big advocate for therapy, as I mentioned. And, I think that all the resources that have been provided here, I think that's one way of like just reaching out, just meeting community where they're at. If we have the capacity, plugging ourselves in those different communities.
Absolutely. Thank you all panelists. The next thing I want to jump into, I'm going to combine something on our list with something I saw from Q&A that kind of interrelate. I'd love to hear from you as it relates to the communities that each of you serve. What would you say some of the greatest needs are to get improved mental health within your communities? And then what are some of the greatest barriers you also see? And how can we work towards addressing those barriers and addressing those needs?
I definitely think access, right, is a huge barrier, whether it's having the financial means to cover, medical insurance to cover, or even just the knowledge to know where to go. And I think that that's the one positive I would say what came out of this COVID pandemic, is that access has increased slightly because we do have that virtual component now that's been very widened. And I have clients who are in like Northern California, right? And because of the wonders of the internet, I have people from Utah and Arizona, New Mexico, like, hey, how can I get therapy from you? And I'm like, unfortunately, right, because of licensing laws, I can't do outside of the state of California, but just that reach is now expanded and understanding that, right? There is still that barrier though, that therapy is a luxury instead of a necessity. So on the back end, the insurance or the accessibility financially is not always there. We see the extended wait times for providers through insurance. We see the lack of resources that meet the financial needs as well, right? As we try to combat this and offer sliding scales or scholarships or different things like that, we can really only do so much. And so that's still very present, right? And it's a systematic thing. And we notice that, right? But we also have this need for holistic care. So like for our population at ICO, we have this need for treatment for our elders. We have the need for the treatment of our Two-Spirit LGBTQ plus community members. We have the need for our males, where it's just not quite there. It's not quite reaching them all the way yet, right? And we're noticing that. We have different things that are set up and in place to address that, to kind of bring that in, to really hone on that. We're offering wellness circles, community gatherings, events like that, just to get it started, just to get the foot in the door. But knowing too at the same time, like, right, we're one organization, we're one group of people, and noticing that that spans out so much wider, like we're just trying to really snowball it as much as we can.
I guess I can offer a little insight. What I can say is that I agree with everybody what they're saying, and I think all of us collectively know that we don't just have like a broken mental health care system. We just in general have a broken healthcare system that just does not work for most people. And mental health care is an even bigger like headache for folks to deal with. And I know how scary and how overwhelming it can feel when you don't have proper insurance, or you're underinsured, or you don't have the finances available, or you can't find the right appointment, or there's a long wait list, or like the doctor that you have prescribed your medications, but you can't afford them, or they only go in the pharmacy. There's like different types of plans that you have to figure out. Sometimes cover mental, sometimes don't, sometimes cover. It's a huge headache, just like dealing with all of this. And I can imagine for a lot of people, they can just say, well, screw it, whatever. I don't even want to deal with any of this. I'll just figure it out myself and do my own thing. And that's tragic, because that's not the fault of anyone. That's the fault of a system not taking care of those who need it the most. And unfortunately, many of us here as providers are sort of handcuffed to that system. We got to work with what we've got. But I think one of the biggest blessings of this system is that we know what it's like for you, and we know what it's like for us on our side. We're sort of like translators between the two, where we can understand how to navigate this system, how to get the most out of this system, what loopholes we can get, what we can help you to do, what services are available that the system will not tell you about. And we're sort of the face to that system to help you understand that. And many of us here also use the same system. I myself, I am in therapy. I seek my own therapist. I figure my own things out with my own insurance and how to navigate the system, because I myself am more than just a doctor. I too am a client, I'm a patient, and I see it from both ends on my side. And so it's important to never ever dismiss or turn away from the system just because you can't afford it, you can't understand it, or it's too cumbersome. Do not. You do yourself a disservice, by doing that. Connect with us, reach out to organizations like MHA, like Khalil Center, reach out to us as individuals. We can help you translate this large, big block of like small text and help you figure out what works best for you in that regard. And this is piggybacking off of the previous question that Jackie asked, which is what can we do as providers to help connect with BIPOC communities? This is how we can connect. It's more than simply just saying that I'm from your country, or I'm from your nationality, I'm from your ethnicity, and I speak your language. It's also translating the system that we work in as well, and translating how to navigate this when you don't have money, when you don't have insurance, when you don't have resources. We can help connect you to whatever we have available. And if it is limited, and in some cases it may be limited, yes, it may be frustrating, it may be difficult to work with, but that should never ever be a reason to not seek care. Should never be a reason to not seek care. Everyone here has the ability and the means to connect in some way, shape, or form to some kind of support and treatment. And even if it's not in the system itself, we can still give you plenty of alternatives outside the system that you can work with. So there's never a reason not to engage with that. So I hope that helps for anyone who may be wondering and maybe feeling just a little insecure about this, of how can I afford this and how can I manage this? Trust me, we know the feeling. We know the feeling, and we know how to help you with that too.
I think I would add the piece around workforce. And so, you know, psychologists of color make up less than 15% of all psychologists in the country. And I think there's similar numbers for psychiatry and for social work and mental health counselors. So I think that can be a barrier, and I kind of approach it towards the need. And so one of the things, the work that we're doing is really encouraging young people to explore psychology and mental health as a career option. I think particularly coming out of the pandemic, we know that mental health is not going away, mental health needs are not going away. And so it is a viable career. Some of the work I do is really helping therapists to start their own practices. And again, really, really showing people that you can have a livable and even wealthy career as a mental professional. There are a lot of messages out there about, one, it's not a real career, and that you can't make any money. And so I really want to shift that narrative about the workforce. So I think a need is to build in that workforce of mental health professionals. A question earlier was about teen and youth. So I worked in high schools for over 17 years. And I would say, it can be a barrier. I think Dr. Sharif talked about mental health being, even a system that's not got a lot of attention and care. And I would say child and youth mental health is even more impacted. And so one of the things that we've seen during the pandemic is an increase in child and adolescent suicide, increase in crisis response and crisis needs. And so some districts are working to put more school counselors in the school systems. I think some schools often shared a counselor. A counselor might have been split between 2 or 3 schools. And so there's a real attention now to making sure that there's more access to therapy and counseling services in schools. So I think that is one thing I think is also a need, is having school systems and school districts really prioritize the mental health. I think there's been a lot of focus on social emotional learning, and I really, my soapbox is it's different than mental health. It is a needed skill, it's a prevention skill, but there's also a need for mental health services and for crisis services in schools.
Absolutely. Thank you all panelists. I know we're getting close to our time here, but before we wrap up, I would love to just conclude our discussion today by hearing from each of you what one takeaway you would want our audience to leave with from our time here today.
My one takeaway would be that mental health care isn't a cookie cutter. It isn't one size fits all. And that you have the choice and the right in your mental health care. If a provider doesn't seem like a good fit, then I really do encourage you to keep trying, don't give up, and seek someone else or something else in terms of what that approach looks like for you.
I'm just going to say that mental health is as important, if not sometimes more important than physical health. there is a deep connection that our spirit and our body and our mind shares. And so we have to cater to all those needs, not just the physical needs. And it's true that taking care of one will also help the other, but sometimes some areas need more help and more attention. So let's try to make sure we cater to all of them, and starting from our own, because if we're thinking about others around us who are suffering and who need help, you can't help them until you feel like you have helped yourself. So put the mask on your own self before you try to put it on others, and try to take a deeper dive and see how you can help yourself in all of those physical, spiritual, and mental areas.
I think that's just one takeaway. So I put my website there because we have a lot of resources on there. And I would also encourage people to go to the Mental Health America website. I think it's really just, and as we think about this, is really about BIPOC mental health. And I think one of the hardest things is people asking for help or taking that first step. And so there are lots of resources. Again, I shared my website, the Mental Health America website. There are a lot of resources within your community or your town. So just find one and just tap into that, right? It could be a peer support, maybe a place where you start. It might be an outpatient therapist. It might be a healing circle or collective like that, but just find one resource and start. You don't have to wait till there's a problem. Go now.
I feel the same. I think one thing is not enough, but my hope is that you were able to feed your curiosity. I know that you all came in with an intention, and I hope that you were able to feel that today. And that I hope you know that you are not alone and that you don't have to navigate this process alone. You have community, you have resources. And whatever that looks like, I hope that you have the confidence and the courage to begin to tap into the resources that are here for you, because there are resources and you're not alone in this process. So that is my hope and my prayer for you, that you know that you're not alone.
So last again, I don't know how to follow that up. I mean, honestly speaking, just the fact that you're all here just listening to this event means that your heart and your mind is already attuned towards recognizing the importance of mental health. So I don't want to preach to the choir, but what I will say is that if you are a provider in particular, the most important thing that I will emphasize is healer, heal thyself. And I speak from experience on this, that we are working in a field and working with clients that take a tremendous toll on ourselves. And because of the fact that we're even in this field to begin with, we all have a very soft heart to begin with that is very giving. And you cannot pour from an empty cup. So what I will say to each and every one of us is that, yes, if you are a provider and you're getting this advice and you're picking up all this stuff from us, the most important thing I want everyone to take away from this is never neglect your own care and never neglect your own health. There is absolutely no shame at all with you yourself seeking therapy and seeking treatment and seeking for yourself. Absolutely none. So self-care is absolutely crucial. And if you need professional self-care, then please engage in professional self-care. There's nothing more heartbreaking than a golden-hearted provider losing that golden heart and then feeling broken by this and then quitting our field. We need everyone here for this. So please make sure to take care of yourselves, seek proper care for yourself. I myself am in therapy, and it's been a huge help for me to help my clients and my patients in that regard. So I would strongly recommend it for everyone else. And then if you are not a provider tuning in and listening to us, the first thing I would say is the best time to seek mental health care for yourself was at the very, very first time you started to experience emotional pain or emotional distress. The second best time to seek that mental health care for yourself is right now, and to not delay it. Don't wait for a crisis in your life to seek mental health care. It's all about preventative care and not reaction. to your care. So if you needed a message or you needed a sign or something to help you take that first major step towards seeking help, I hope this particular webinar, you tuning in and listening to each of us, was that first sign for you. If you didn't hear it from one of us, hear it from the 5 of us. Please, 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 please. You know, Google it online, reach out to one of us, connect with MHA, whatever it takes. Just send that one message and start your journey towards your healing. So that's my, you know, spiel for this. Thank you everybody so much for this. And thank you, Jackie, for being awesome and being an amazing host. Thank you.
Absolutely. Thank you all so much. What a wonderful way to wrap up. Thank you to everyone who has joined us here today. Just a reminder, we'll be sending out the recording and also some of these great links our panelists have provided. I'll make sure we include in the follow-up email to you all as well. So you'll be able to access them. Just thank you for a wonderful session to each and every one of our panelists here today. We all have learned so much, and you have really provided this wonderful safe space to learn, and I'm just so appreciative to each of you. I can tell everyone in the chat is, and thank you all for joining us today. I'll be in touch in the next few days with those follow-up materials, and thank you everyone. Have a wonderful rest of your week, and enjoy the rest of your day as well. Thank you all.
Thank you.
Thank you. Bye. Thanks for coming.